Hey there, so glad you found us today. My name is Mike. I'm with Covenant Caregivers. We are a non-medical home care service based in Madison, Mississippi. We serve Jackson metro area, Hines, Rankin, and Madison counties, as well as Hattiesburg. So this is our new YouTube video series that we have begun. We are wanting to be a senior care resource for you and doing that through video. So one of the things that would help is if you would subscribe, hit the subscribe button on YouTube. That would be great. We would really appreciate that. You can also like us on Facebook, follow us on Instagram or LinkedIn. It's all going to be found real easily by searching Covenant Caregivers on any of those social media platforms. So today we're going to talk about senior living options. We do a lot of work in the different senior living communities in the area, and I have got 8 years of experience in assisted living and memory care prior to opening Covenant Caregivers. So along with some of my colleagues here that we've got a lot we can share with you about senior living. So basically there are 4 levels of care within the senior living continuum: independent living, assisted living, memory care, and then skilled nursing. We're going to talk about independent living first. You can see on the screen all these things, these great things that are offered in an independent living community. I love the independent living setting, those active senior adults that are basically living in a really cool, nice apartment complex with their peers. They can have meals together, participate in activities together, and also get some services like housekeeping and transportation. And one really important thing is being in that building full of people and you have a staff member that mans that front desk 24 hours a day, seeing the comings and going, who's coming in our community. That provides great security for you or your loved one. Assisted living is going to provide all those same things that independent living does, but it's also going to start helping you with activities of daily living, which we call ADLs. The activities of daily living are bathing, dressing, grooming, things like that, where you're just needing some assistance with those things to do them safely. So in an assisted living setting, you're going to have staff there 24 hours a day that can help you with those things. And also medication management, making sure you've got your medicines, that you're getting your meds on time and when you're supposed to be taking them, and not having to worry about refills or when things are going to run out. They're going to take care of that for you. A memory care program is typically found within the walls of an assisted living or skilled nursing community. So again, all of these top things that you were getting in those other levels of care, you're going to continue to get those in a memory care setting with your assistance with activities of daily living, medication management. And one of the primary differentiators for memory care will be the activity program. It is going to be a therapeutic activity program that is run by someone that has been trained to work with people with a dementia diagnosis, whether it is Alzheimer's or some other form of dementia. The staff is going to be trained specifically to dementia, so that you have people around your loved ones who understand the behaviors that they may be exhibiting, or some of the things that you do when you have dementia. They're going to know how to handle those things, redirect, and all staff members in memory care typically participate in the therapeutic activity program. Finally, skilled nursing. This is your highest level of care. This is where you have nurses around the clock, you have CNAs, nursing assistants there around the clock. You even have physician oversight, nurse practitioners that are making rounds on the residents. They are keeping a very close eye 24/7 on their residents. If an illness begins to pop up, they're able to get that under control very quickly. So the medication is going to always, of course, be managed in these skilled nursing communities. They can also do special diets. If your physician has ordered that you have to have a certain type of diet, they can do that. They can also help with wound care. They can manage that for you. And again, just that physician or nurse practitioner oversight is really going to be focused on the medical side and those needs that your loved one has medically, they will be on that. Now, with all of these levels of care, even independent living, there is on-site rehab. So all of the communities that we're in and out of every week, they have a rehab department with physical therapists, occupational therapists, and speech therapists. So when your physician orders that type of care for you, you can get those in any of these levels of care. Okay, so there's something called a continuing care retirement community. They're not all over the place, but we do have some in our areas, and that is going to be a campus where you have all these levels of care right there on the same campus. So independent living, assisted living, memory care, and skilled nursing. Those are communities where you can move in a very independent, active senior, but know that you have access to all these other levels of care on that campus. Now, cost is always something that people need to know about, and here are some ranges for you for independent living through skilled nursing. The ranges can be pretty broad based on just all the different types of communities that we have in the area. Some are very small, more intimate settings. Some are very large communities with lots of residents, and some have maybe some additional amenities that others don't, and that can affect price. Some have some companion living where you have a roommate, let's say, that can make the price lower, and then others are strictly private. So there are some things that will make the price be different within the same level of care. But this is something you would need to get from the communities that you are actually considering. And finally, who does pay for senior care? I wish that we could make it easy and say Medicare just covers it all, but as you probably already know, that's not true. A lot of these types of communities are private pay only. So that is an out-of-pocket expense that you are paying to live there in the community. Now, long-term care insurance is a lifesaver for many people. It allows them to live in a community where they are needing assistance and they're able to qualify for their policy now and start reaping the benefits of that policy. The Medicaid waiver program will help with assisted living. There are some pretty strict income requirements and asset limitations, but that would be something you could speak to the Department of Medicaid about. And then finally, the VA. VA has some nursing homes across the state that are great, and that's a wonderful benefit of the VA. The VA also offers a pension that's called aid and attendance. That will pay for pay for part of an assisted living. So to find out if you are eligible for that, you can give us a call. We partner with an agency that will walk you through that process and determine whether or not you qualify for the aid and attendance program. One caveat I want to mention is in skilled nursing, many people use that for a short-term rehab. Let's say someone has fallen at home and they've broken a hip, they've had hip surgery, and before they can go back home, they need to get some pretty intense rehab. Well, they may go to a skilled nursing community where the rehab is on site, and they're going to get that intense rehab for a certain number of days or weeks before they go back home. So that is the one area that Medicare will come into play, that short-term rehab. Now, depending on how long you stay in rehab, you may begin to become responsible for a portion of the daily fees. But that, again, would be something you'd want to make sure of when you're talking with skilled nursing or skilled rehab after an accident or something like that. But that is the one time that Medicare will help out some. And then finally, how do you choose? What is your first step? You know that mom or dad needs to be in a community of some sort. So what do you do? Well, hopefully with what I've shared with you so far, you would kind of know, well, I don't need memory care yet, or we're really just looking for a safe place. Mom can do everything, so maybe independent living is really what you're looking for. So once you determine that, then I would suggest calling the facilities that are located nearest you. You're going to visit more often if the community is close by your home, or even other people in your family that live near a particular community. So location is key. I would want to see 3 or 4 different places, depending, whatever level of care I'm looking at. If it's assisted living, I want to go to 3 or 4 of them. And I want to have a tour set up, maybe eat a meal there, just observe the other residents and family members and staff members. All of the places that we work in would love to have you come by and show you around and tell you exactly what they offer. Ask lots of questions. If you know you've got particular needs, or your loved one has particular needs, make sure you ask those questions. Will you be able to do this for mom or dad? Don't hesitate. They want you to ask those questions. And finally, asking maybe for a family member of someone that lives there or used to live there as a reference, just to give them a call. There's many times people willing to chat with you about their experience and how their mom or dad did in a particular community. So I think that's a great thing to do for a more thorough check, and just to know, is this the best place for mom or dad? If we can help you in any way, we would love to do that. We talk to people all the time about senior living communities. Here are 4 of us in the office that do it on a regular basis. We even have a few more that can help you, but we would love to answer your questions, help you, steer you in the right direction. And then, of course, nothing replaces actually visiting yourself, asking the very specific questions to the community representative. But when you're just starting out with this, it can be a little overwhelming. You really don't know what to do, where to start. Give us a call, 601-856-5660, and we would be happy to help. Again, don't forget to subscribe to our YouTube channel for more videos like this. This one was a little bit longer today. Sometimes they're very short, but subscribe there. Follow us on Instagram and LinkedIn, and like us on Facebook, and we will see you soon.